the scene is a guy who is crashing into a fireworks factory, and it goes off. And Lieutenant Detective Frank Drebin stands in front of it as bombs are going off and fireworks are going off, and nothing to see here. Move along. Nothing to see here. And that's what I think of, because it's Baghdad Bob of there are no Americans. It's ridiculous. Yet we have arguments that are being put to us in a way that is really sad. And I thought I would only get this from the likes of, MSNBC, which is a network on a division, cable division of NBC. And there's this person called Rachel Maddow. Now, she's been called the smartest person on the planet by anybody who introduces her on late night or as a guest on Bill Maher's program. Reason I know this is I always highlight it because I think, wow, first off, who is she? Not many people know, ratings-wise. And how'd she get so smart when she makes these types of statements? And in clip one, this is similar to what President Obama said today. Now think about what she's saying right here, right now. Roll it.
Republican politicians really do hate this law, but it is doing what it was supposed to do. The number of uninsured people in our country has dropped by 9.5 million people because of this law. And the new political reality of Obamacare is that wishing for Obamacare to go away can no longer just be a wish that exists in an ideological vacuum. The policy exists now, and wishing for it to go away means now that you're wishing that 9.5 million Americans who just got health insurance, you're wishing that they would go back to being uninsured.
Really? 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 Ms. Maddow? Is that what you think? I want people to be uninsured? I'll get to your number in a second. We've got to get to our wonderful guest, who is Dr. Paul Howard, PhD of the Manhattan Institute, senior fellow there. And he's extraordinary because he walks us through all this. Paul, normally I would do kind of a rant on this and do the really, and kind of get into it and allow myself to be walk into it. But when the president, in essence, repeated her today, what's your problem with people who have health insurance? What's wrong with you? I'm gonna ask you this now. And I don't like wasting your time with this stuff. Thank you, self-censor, Crane Durham. Your thoughts on Ms. Maddow's statement that, hey, when you really are going after Obamacare, what you're doing is you're trying to deny people who have health insurance for the first time?
Right.
And yet, that's who you are.
Obviously, this is a straw person, straw man, straw woman. It's because obviously Republicans want to, or conservatives want to replace the Affordable Care Act, Obamacare, with a real conservative, patient-centered solution, that expands coverage. And let's not forget that millions of people had to lose their policies that were canceled last year in order to be compliant with the law. Lots of exceptions were made for them. But on net, we could see more people lose private insurance. It's potentially true. Lose private insurance, and more of them wind up in Medicaid, which has very poor health outcomes compared to private insurance, or wind up paying more for health insurance. And at least, for the time being, the data that we've seen suggests that the vast majority of the people who are getting coverage were not previously uninsured. They were insured somewhere else, and they just went on to the exchange to get subsidies to get compliant coverage with the law. So it's important to note, if someone was sick and couldn't find affordable coverage before and they've got it for the first time, that's an achievement. But at the same time, if we're driving up costs for the rest of the market for everyone who's uninsured, who didn't get a subsidy or can't get a subsidy, then we're making it more expensive and harder for people to get coverage. And, that's the reality of the market that Obamacare is pushing us into. It's making insurance more expensive, giving subsidies to some, but by far not all.
And you say that as Paul Howard, your PhD, a Manhattan Senior Fellow, but you are also the director of the Manhattan Institute Center for Medical Progress. True progress, by the way. Oftentimes that's misused. A contributor to Apothecary, the influential Forbes blog on healthcare policy and entitlement reform. The only reason I mention that is, number one, you deserve your title. You've done an extraordinary amount of research. You've dedicated your professional work to actually fixing a problem, fixing it, not papering it over and not playing propaganda, emotional games and straw person arguments with them. And they're claiming numbers here. 7.1 million signing up. And you just talked about the people that were previously uninsured who got insurance. When we speak to those 40 to 50 million people that have previously been uninsured that now have insurance because of this law, Paul, what percentage are we talking here?
Right. So according to the best estimates, and these are just surveys right now, McKinsey had only, I think it was 15% previously uninsured. More recent studies have suggested that it's closer to 30% previously uninsured. The rest, 2/3, had coverage before. We're going to see those numbers come out. The administration could have answered that question, or at least we'll be able to answer that question pretty definitively in a couple of weeks just by saying, look, how many people were insured last year in the small group and individual markets, and how many of them are insured this year in the individual and small group markets? And if that number has gone up, you're thinking, okay, back of the envelope, that's a net new coverage. But if the number is either flat or has gone down, then you're saying most of the people it's just churn, and we might have even lost coverage. So that's the real concern there, is that there is obviously a lot of churn in the market, people moving back and forth. Obamacare canceled a lot of policies. I'd also add, if you just go back and look at the trend, which Chris Conover does, he's one of my Forbes colleagues, and look and said, what were CBO estimates back, when the law passed, and then even up to last year, in 2013, CBO estimated 13 million net newly insured Americans this year. By any measure, you're going to fall far, far short of that measure of success of saying we're covering 13 million Americans who were previously uninsured.
And there have been reports of just 1.7% of the uninsured are now covered. I mean, that could be because you just talked about the fact of, okay, the net, what are we left with before and after? And when we address the 48.6 million, and that I put that in quotations of Chris Farley, then specifically we're only addressing 1 point. Is that possible? Is that or is that an exaggeration in your mind?
Well, the numbers are so messy at this point. So for instance, the administration will claim, and I don't know what the latest numbers, but I think let's say 5 or 6 million have been covered through Medicaid. People are moving in and out of Medicaid. People who were previously eligible for Medicaid but just didn't bother to sign up have signed up. I think it's really debatable whether or not you should count those as new enrollees, but you could obviously say that if they didn't bother to sign up before, the value of insurance to them was probably pretty low. So who are the people in expansion states, the states that have expanded their Medicaid coverage to the Obamacare levels, who have new signees? Very difficult question to answer, but that's probably a fraction of the 4 or 5 million that are quoted by the administration. And then again, you have to go back at the market and say, net of the policies that were canceled, who's got truly new coverage for the first time, and at what cost? I mean, that's the other question.
Yeah, and what is that cost in the percentage-wise? Because I've seen charts and graphs on estimations and a whole host of things, but it looks like the vast majority of people that have signed up are receiving subsidies.
Right. So you've got a little over 80%. I think the latest estimates were 83% of the people who are getting exchange coverage or getting subsidized coverage of at least some kind. That's probably pretty substantial discounts to those people. So what that tells you is those are very low-income people who are below the threshold of probably around 200% of the federal poverty level, $20,000 a year for an individual. Getting very heavily subsidized policies, to the tunes of, $10,000 or $15,000 worth of government subsidies to offset those costs. So it is an enormous subsidy for that population. But again, you've also made the product that much more expensive and harder to buy for that population. So the debate has never been like, can we spend more money to get people covered? I think the right debate to have is, how do you bring the cost of insurance down so it's more affordable for everyone?
I want to get to that.
Spending $1 trillion over the next 10 years to try and buy people in.
Absolutely. And pardon me for interrupting there, my friend. Here's something I'm going to do for you, and I want you to stay on the show and come back. But I'm playing Debbie Wasserman Schultz, and she's going to say something. Now, I know you're not about R's or D's, anything, but there are annoying people in all parties, okay? And they're annoying because oftentimes what they say is not lined up with the truth. Crane, people think you're annoying. I get it. Stop it. Here's the deal. She is going after the promise of Obamacare here and asked if she would fix anything in the law, which you opened with the Republicans. I want to play this for you. I want you to take aim at the problems that we had, which she'll mention about uninsured people, emergency rooms, that kind of the expenses, the reason we did all this, and then talk about the reforms that were offered and have been offered by Republicans regarding healthcare. And you could talk about general reforms in general. Roll it.
Lower cost prescription drugs, no more medical bankruptcy, people who have pre-existing conditions not being dropped or denied coverage, better, more affordable health care. And they're going to see Democrats who helps make that possible and want to address any problems that as they might arise.
Let me ask you about this with the addressing of the problems. Give me a bill right now you would introduce to address a problem.
Well, there's no specific bill actually right now that I would address because it's...
You don't view there's a legislative problem that needs to be fixed?
You know, I think there are going to be issues that arise around the margins that if we just have a chance to sit down with Republicans like we've done with hundreds of bills through years of our history, that we could hammer out problems that arise. But when you're...
What is one? You don't have one that's on your radar screen?
That comes to mind immediately? No, nothing glaring. I'm not saying that there aren't problems, but there are always going to be ticks in a law that arise, and what we should be doing is sitting down and working those out.
Okay, Dr. Paul Howard, PhD, Manhattan Institute Senior Fellow. Let me ask you, address why we did this, the concerns, why they don't have to worry now. That's what she says, and where we are now and the reform that is possible. Roll it.
Right.
Go ahead.
We got into this fix because there was this understanding that there were, or belief that there were 50 million uninsured Americans in the U.S., that there were lots and lots of people who had very serious conditions, cancer, other conditions that made them effectively uninsurable, and that this law was going to fix those problems. The law is not by any means going to get us any closer to universal coverage, which I think is what people keep saying, but it's really not going to get us anywhere close to that. The Congressional Budget Office estimates that by 2024, we're still going to have, I believe, 20 to 25 million uninsured. So we'll have effectively reduced the rate of uninsurance in the U.S. from about 15% to 10%, so by about a third, but still, again, an enormous, well over $1 trillion cost. And if you look at the full cost of implementing the law, it's close to $2 trillion, over $2 trillion when it's fully implemented. So it's enormously expensive. And then, as far as medical bankruptcies, I think that was a red herring to begin with. But let's not forget, a lot of Obamacare plans are going to have significant deductibles, premiums, and still for people who don't qualify for subsidies, insurance is still unaffordable for them, and it's been made less affordable by the Affordable Care Act, which is deeply ironic. But again, I would say the problems you need to fix, affordability, still need to fix affordability. You've created another tranche of subsidies for one population, but you still haven't solved the problem of people who don't get insurance through one government program or another or through their employers. Those people are still without help today. And then you've got new problems, surrounding networks where people don't understand what physicians are covered by their plans under Obamacare or hospitals, and very difficult time finding tailored solutions for themselves and their families. That's the place where we need to go right now. I think, look, Republicans deserve some share of at least their blame for not implementing their solutions when they did have control of government back in the early 2000s. Where they need to go from now is to say, look, here are the flaws in the law that we would fix, extraordinarily regulatory expensive, enormous taxes, doesn't fix the fundamental problems of cost and quality in the system. And here are solutions that give more power to consumers, level the playing field for people who don't get insurance through their employers or through a government program, and reform the existing entitlements, which is something we don't often talk about, but we're already spending $1 trillion, close to $1 trillion a year on Medicare and Medicaid, at least we will by 2019. That money is increasingly eating up more and more share of everything else the government does. So if you flatline, if you look at the government spending, all other spending outside of healthcare is basically flatlined, since the 1970s. It's government spending on healthcare and healthcare entitlements that is rising more rapidly than any other aspect of government's, reach. So as long as that remains unchecked, government spending is going to, or healthcare spending is going to eat up every tax dollar we send to D.C., which means either government's going to go out of business and stop, fixing roads and things like that, or our taxes are going to shoot up to astronomical levels.
Dr. Paul Howard, PhD, Manhattan Institute Senior Fellow and Director of the Manhattan Institute Center for Medical Progress. You are an all-star, man. I'm not patronizing you. I just appreciate you and delivering the truth. It's not about R's or D's. It's about accountability, and we need reliable sources. And Nothing But Truth is proud to feature you, my friend. Thank you for taking the time.
It's always a pleasure. Thank you.
Take care. Crane Durham's Nothing But Truth. Now we're going to lighten it up a little with a comedian that thinks Ted Cruz is really funny, but not in a good way. Crane Durham's Nothing But Truth, AFR Talk.